Do GPs and health professionals get together to discuss a young person's health condition?
Yes, we do. It's really important because we all bring something different. I don't talk to anyone outside of health without your permission. So even talking to Mrs. Clark or talking to the teachers, I would need you or your family's permission to do that. But we find it really helpful to be able to do that, but it stays within the surgery.
At what point should you seek help if you're concerned about your mental health?
I think the short answer is when it starts to, if you think your mental health is impacting on other aspects of your life. So I would be really worried about someone whose sleep is really poor. So if each night you're not sleeping well, the next day it gets really hard to feel happy again, and then you can end up in a bit of a cycle where you're not sleeping and then you get grumpy and things start going wrong. So that's one of the things that really worries me. But if it's impacting on, say, your schoolwork, so you can't concentrate, or for instance, if it stopped you eating, if you really lost your appetite, again, that would really worry me. So if it affects the way your body works, then I'd be getting really worried. It's always really hard to disentangle because there are things that happen to us day to day, and there are good things and bad things, and it's normal to have times when we're sad, and it's normal to have times when we're happy, but sometimes things get too far in one direction, and if you find you're constantly really sad, then that's a problem, and we really want to know about it, because there are things we can do to help.
How do you think parents' reactions and attitudes affect young people's mental health?
That's a really good question. There are so many things that influence and impact on our mental health, and the environment around us is one of those things, but that can be anything from our friends to parents to teachers around us, and most of the time people are really supportive, but you also have to think that everyone's got their own things going on, and sometimes if, for instance, your parents have got something going on, sometimes it means that they may not be as available to you, but I think everything influences our kind of mental health and well-being, from kind of how we are physically, how we're sleeping, how we're eating, how we look after ourselves. But I think you guys have done the Clangers thing, haven't you? So the thing about connect and learn and being active and noticing and giving, those sorts of things, that's a really good way of kind of structuring, of looking at how we can look after ourselves, really. So that's the thing I always come back to. If you're trying to work out what are the things that you can do, that's a really good system for trying to think, actually that's how I can make sure I'm in my best state, really.
What types of treatment or support are commonly given to young people you see with mild or moderate mental health issues like anxiety or depression?
We try really hard to avoid medication in young people. There are roles for medication, but most of the time we really try to avoid it. So we really try and focus on talking therapies. So the idea of talking about how you're feeling and looking at sort of looking at the way we think and trying to identify when the ways we think are not as helpful as they could be, and trying to identify ways to think in more helpful ways, really. So as I say, it really kind of talking therapies, and that varies from counselling, which is talking about some of the things going on in your life, to cognitive behavioural therapy, which is looking at our responses to individual situations and trying to ensure that they're as healthy and as positive as they can be.
Are there any types of mental health issues that can be dealt with by a nurse instead of having to see the GP?
We have psychiatric nurses, mental health nurses working in the surgery, and often they're the best people to talk to. Our practice nurses are also trained in mental health, and they can identify and recognise and often deal with mental health issues as well. So these days it's much less about just seeing a GP, as there's members of the team and we all bring different skills to it. So yeah, absolutely. For some people, seeing a mental health nurse is the best outcome. Often as GPs we do a lot more prescribing, we're focused more on medicines, whereas actually a mental health nurse may well have longer appointments to deal with talking therapies and to deal in a bit more depth with some of the issues that are going on. So we try and make sure we get the right person to talk to you so that you don't end up having to tell your story lots of times, because we think that's the most effective way of dealing with things.
Some young people don't know what to do if they find themselves in a situation where they're struggling with their mental health. What would your advice be?
Yes, it's difficult. It's really difficult to know whether what you're going through is normal or not. And I think talking to people is the most important thing. We've really tried to emphasise how important it is to talk, to have people that you trust, that you can talk to. So I think in those circumstances, talking to a teacher, talking to a friend, talking to a colleague, just saying this is how I'm feeling, is this a problem? You know, there's something weird about sharing something. If you share it, you take the burden off and you kind of spread the load a bit, and other people start to look out for you, and that's really powerful. It's really important. Does that answer your question?
Yeah.
If you get advised to seek help with your mental health, how long does it take to get an appointment with a counsellor?
It's a very good question. It's usually fairly quick to see a GP or to see someone at the practice. At the moment in Herefordshire, it can take a bit longer to get counselling, and I think it's in the region of a couple of months to get counselling, which I don't think is good enough. I think I'd really like to see it much quicker so that we can have access to help. But there is going to be a new service coming into schools where we're going to have more mental health professionals tied into schools, so that it's going to be much quicker to get help, because we think it's really important. It's hard to think of anything more important than children's mental health, and so we're really trying hard to make it as accessible as possible for people to get help and to get help early. But someone like a school nurse you can see very quickly.
Is there a shortage of counsellors today?
Yeah, that's exactly right. We're trying to get new people, but it takes a while to train people and to get them confident, and so that they're able to have the skills that they need to do it. But we're also trying to get more investment into children's mental health, because if we get it right at this stage, then you actually make a huge difference to someone's adult life. You know, if someone's showing signs of mental health problems as a child or young person, and we don't deal with that, you can have problems for a long time. So what's really important is that we intervene early, that we get people help as soon as we can to try and stop it becoming a problem later on.
Thank you.